Welcome back, my dear students. Today we are going to explore atherosclerosis, a hidden disease of the arteries where fatty deposits called plaques slowly build up inside the vessel walls. This build up narrows the arteries and makes them hard and reduces blood flow into the vital organs like the heart and the brain. In today's class, we will uncover or we will explore how atherosclerosis begins with a small injury in the artery wall, how plaques form step by step, and how they grow into stable or unstable lesions that can cause serious problems like heart attack and stroke. Let's make the stages of atherosclerosis simple, clear and easy to remember. Atherosclerosis, which can be called as the silent blockage disease. What is atherosclerosis? It is a long-term or chronic disease of the arteries. It happens when fatty deposits or plaques build up inside the walls of medium and large arteries. This causes the arteries to narrow, less spaces for blood to flow, and harden, less flexible. Result: reduced blood flow can cause heart attack, stroke, or peripheral artery disease. How atherosclerosis develops: step by step pathogenesis. Endothelial injury, like the trigger point, the innermost lining of the artery or endothelium gets damaged due to high blood pressure, smoking, high cholesterol, diabetes, free radical, toxins, infections, etc. Once damaged, the endothelium becomes leaky to fats or lipids. Lipid infiltration: LDL cholesterol or bad cholesterol enters the damaged wall. Inside it gets oxidized or damaged by oxygen. This attracts monocytes into macrophages, which are the scavenger cells. This is atherosclerosis, the normal artery, and this is plaque formation during atherosclerosis, and the formation, growth and rupture of the plaque and the blood clot forms. This is the progression of atherosclerosis. Fatty streak formation: this is the image of fatty streak formation. Macrophages eat oxidized LDL and become foam cells. These foam cells collect under the endothelium, forming yellowish fat streak. This is the fat streak. First visible lesion. Inflammation: macrophages and T cells release cytokines, inflammatory chemicals, and this inflammation continues. Smooth muscle cells move from the middle layer to the inner layer. Fibrous plaque formation: smooth muscle cells multiply and make collagen and extracellular matrix. A fibrous cap forms over the fatty core, creating a hard plaque. This narrow down the artery. Complications, which are the danger stage: when plaque can calcify, artery becomes stiff or hardened. If fibrous cap ruptures, blood clot or thrombus forms. This can completely block the artery, leading to heart attack or stroke. Atherosclerosis step by step pathophysiology. Step 1: endothelial injury or trigger. It causes hypertension, smoking, diabetes, HDL, etc. High LDL. Effect: endothelium becomes leaky and sticky, more permeable, and adhesion molecules becomes higher. Step 2: LDL entry and oxidation. When high LDL level, we have mentioned in the first point, endothelial injury occurs due to high LDL level. Then this LDL slips into the intima and oxidizes, acts like a danger signal. Then third is the monocyte recruitment and conversion into macrophages, of macrophages into foam cells. Monocytes stick, they enter cell and become macrophages, eat oxidized LDL and it will be transformed into foam cells. And fatty streaks forms, earliest visible lesion. Inflammation amplify, then macrophages or T cells releases cytokines and growth factor. Their chronic inflammation continues, and then smooth muscle cells from media, which is intima, they multiply under cytokine influence. Then smooth muscle cells make collagen and extracellular matrix. A fibrous cap forms over a lipid core. Then plaque grows, lumen narrows, and it reduces blood flow. Plaque evolution and complications. Stable plaque: thick cap, smaller lipid core, often calcified, chronic narrowing, angina, less claudication. Unstable vulnerable plaque: thin cap, large lipid core, Active inflammation causes cap rupture, then thrombosis, then heart attack, stroke, and sudden death. Risk factors, it can be modifiable. You can control this high LDL or low LDL or high triglycerides or bad blood fats, high blood pressure, smoking, diabetes or insulin resistance, obesity, lack of exercise, unhealthy diet, junk food, saturated fat and trans fat, too much alcohol, chronic stress. Non-modifiable, you cannot change these points or factors. Age, risk goes up with age. Gender, men at higher risk. Women protected before menopause by estrogen. Family history, it is genetics play a role. Management, lifestyle change, which is the most important. Eat healthy, less saturated fats, more fruits, veggies and whole grains. Exercise regularly, maintain healthy weight, quit smoking, limit alcohol, stress control, yoga or meditation. Medications with the help of doctors, statins, uh, atorvastatin, lower LDL and stabilizes plaques. Other cholesterol drugs like ezetimibe, PCSK9 inhibitors, blood pressure drugs, ACE inhibitors, ARBs, beta blockers, antiplatelets like aspirin or clopidogrel prevent clotting, anti-diabetic drugs for diabetic patients, surgical or interventional for severe cases, angioplasty or stent PCI opens the blocked artery, CABG or bypass surgery makes a new route for blood flow, endarterectomy surgical removal of the plug or carotid or peripheral arteries. In short, atherosclerosis is the fat plus inflammation inside arteries which form the plaque, narrowing of the diameter of the artery, then possible rupture and heart attack and stroke. But good lifestyle plus medicines can prevent and treat the condition. I hope this class helped you understand atherosclerosis stages, how plaques form and grow inside our arteries. We explored how endothelial injury sets the stage, how LDL cholesterol enters and oxidizes, leading to foam cell and fatty streak formation, and how inflammation, smooth muscle migration, and collagen deposition turn these streaks into mature plaques. Finally, we saw how plaques can either remain stable, causing chronic narrowing and reduced blood flow, or rupture suddenly, leading to thrombosis, heart attack, or stroke. Remember, atherosclerosis is a slow but preventable disease. With healthy lifestyle choices, timely treatment, and proper management, we can reduce its risks and protect our heart and brain. Stay consistent, stay healthy, and keep learning. See you in the next class. Thank you.